Hello class. This video is to address our Unit 1 Histology. There are only a few slides of histological specimens that you are responsible for Lab Unit 1. Again, these are all fair game and can be tested on your first lab exam. The first tissue I want to address here is dense regular connective tissue. You can read about dense regular connective tissue in Chapter 4 of your textbook. Dense connective tissue is composed primarily of protein fibers and has proportionally less ground substance than loose connective tissue. Dense connective tissue is sometimes called collagenous tissue because collagen fibers are the prominent, dominant fiber type. In dense, regular connective tissue, the collagen fibers are packed tightly and aligned parallel to an applied force. This tissue type is found in tendons and ligaments where stress is applied in a single direction. Dense, regular connective tissue has few blood vessels, and thus it takes a long time to heal following an injury, like when you pull a tendon. So again, dense regular connective tissue, primarily collagen fibers. The dots that you are seeing there are fibroblasts. Fibroblasts are the cells responsible for making this collagen fiber, or fibers, I should say. The next tissue I want to highlight is hyaline cartilage. Hyaline cartilage is the most abundant type of cartilage you have in your body. Cartilage of all types is avascular. That means there is not a blood supply. You can see these cells. These cells are called chondrocytes. And you can see the cells are living in these spaces called lacunae. The little dot here that you're seeing in the middle is the cell nucleus. And these homes that they're living in are the lacunae. Lacuna is singular. Okay, again, here you can see a lacuna, and we can see that there are about 3 cells living in that lacuna. Here is another lacuna with a single cell living in it. Again, you can read about cartilage in Chapter 4 as well as in Chapter 6. Cartilage has a firm gel-like extracellular matrix composed of both protein fibers and ground substance. Mature cartilage cells are called chondrocytes, and again, those are the ones that are living in the lacunae. The physical properties of cartilage can vary with the extracellular contents. For example, hyaline cartilage, like I said, is the most common type of cartilage and is also the weakest. It is named for its clear, glassy appearance under the microscope. The chondrocytes within their lacunae are irregularly scattered throughout the extracellular matrix. However, the collagen within the matrix is not readily seen by light microscopy because it is primarily in the form of submicroscopic fibrils. It is a very delicate collagen type that is used. So although you do not see the wavy collagen fibers like you did in the previous slide, I assure you those collagen fibers are there. The function for hyaline cartilage is to provide support, flexibility, and resilience. Hyaline cartilage is surrounded by perichondrium. If the hyaline cartilage is stained with a certain stain and then examined under the microscope, the tissue resembles carbonated grape soda, or my students like to say, raisins stuck in pink stained glass. Hyaline cartilage has many functions in addition to its primary one of supporting soft tissue. It forms most of the fetal skeleton and is a model for most future bone growth, especially if we're thinking about the endochondral ossification procedure. The cartilage at the articular ends of long bones allows the bones in a joint to move freely and easily. Hyaline cartilage is found in many other areas of the body, including the nose, trachea, most of the larynx, the costal cartilages, that's the cartilage that attaches to the ribs, and the articular ends of long bones, as I just said. Here is another kind of cartilage. This is elastic cartilage, and again, you can see the chondrocytes living in the lacunae. Lacuna is singular. Elastic cartilage is named because it contains numerous elastic fibers in the matrix. The higher concentration of elastic fibers in this cartilage causes it to appear yellow in fresh sections. This is not a fresh section. It clearly does not look yellow. The chondrocytes of elastic cartilage are almost indistinguishable from those of hyaline cartilage. They are typically closely packed and surrounded by only a small amount of extracellular matrix. The elastic fibers are both denser and more highly branched in the central region of the extracellular matrix, where they form a web-like mesh around the chondrocytes within the lacuna. So you can kind of see this web-like mesh, these fibers that are in the extracellular matrix, all around the chondrocytes that are in the lacuna. Elastic cartilage is found in the epiglottis. That's your one of the cartilages in your larynx that prevents your food that you just swallow from entering the trachea. You can also see elastic cartilage in the pinna of your ear. That's what most students call it, your earlobe. No, the pinna is the part above your earlobe, and you can just hold it, squeeze your ear for about 10 seconds, and then release. And you notice your ear goes back to its original shape. One of the most important properties of elastic tissue is the ability to go back to the original shape. Elastic fibers are stretchable for sure, but that's not the most important property of elastic fibers, not stretchability. Rather, the ability to recoil and go back to its original shape. So elastic cartilage, its function is to provide some flexibility and recoil, and it is also avascular. Remember, all cartilage is avascular. This last slide is, well, it's not our last slide, almost, is fibrocartilage. So it's our last of our 3 cartilage types. Fibrocartilage has numerous coarse, readily visible fibers in its extracellular matrix. It is again, like the other cartilages, more gel-like for the extracellular matrix. The fibers are arranged as irregular bundles between large chondrocytes. The chondrocytes don't look large in this picture because we're not at a high magnification, but we can see the chondrocytes here living in their lacunae. And my students like to say that this looks like little speckles of candy in cotton candy. So this fluffiness, they think of the cotton candy fibers, and then the dots, they say, look like candy speckles embedded in the cotton candy fibers. So these fibers, again, are irregularly bundled together. There's a sparse amount of ground substance, and often the chondrocytes are arranged in parallel rows. The densely interwoven collagen fibers contribute to the extreme durability of this type of cartilage. It has no perichondrium because stress applied at the surface of the fibrocartilage would easily destroy that tissue layer. Fibrocartilage is found in the intervertebral discs, the pubic symphysis, and the menisci of the knee joint. It acts as a shock absorber, resists compression and pulling forces or tension forces. The last tissue I want to tell you about is bone. This repeating unit shown here in the bracket is an osteon. Osteons are also called Haversian systems. Osteon is the better word choice to use. These repeating units of bone these osteons are referred to as the unit of bone, the functional unit of bone. You're going to be learning about functional units for a lot of different organs. These concentric rings that you are seeing here, looping around and around, are called lamellae. Lamellae. Lamella is singular. They are rows of collagen fibers, and the collagen fibers are oriented in opposite directions. This allows the bone to be able to actually sustain some torsion, some twisting. We don't think of our bones as really twisting, but they are allowed some twisting range of motion. In the very center, we have the central canal, and this is where we find an artery, vein, and a neuron, a nerve, sorry. The central canal can also be called the Haversian canal. Again, the better term is central canal. At the end of the dotted pointer, you are again seeing a lacuna, singular, lacunae, plural. The cells that would be living there are mature bone cells called osteocytes. Where do you find bone? Well, obviously in your bones. So this is also known as osseous tissue. That concludes our discussion for the Lab Unit 1 Histology.